Morning, sir.
All right, my friend, very good.
How are you?
Very good. बस ठीक है बाबा जी.
बात फिर नहीं पाएंगे.
Hey,
Dr. Kaur.
All right.
how are you,
Good
sir?
afternoon, sir.
कैसे हैं सर?
Yes,
बहुत
Yeah.
अच्छा. Okay. Today is already a third day, right?
Yeah, third day. And we actually had a very wonderful day last 2 days. We had Greg Stone, Frank Wheat, Ian Lumsden, and we had Roger Grinal, Horst Stewart. And yesterday, we also had a Nobel laureate for about 40 minutes talk. So it was quite good.
wonderful. And the interesting part was the whole technology is functioning great.
Yeah.
Pictures are clear. I hear you so vividly. It's fantastic.
And we also had a full session on, digital technology and AI.
Yep.
And
Exactly. Artificial intelligence and so on.
Dr. Sani and Dr. Krishnan speak so high of you. We haven't met, but
Yes, with God's case, maybe sometimes second visit will make it and call you up.
Sure.
Absolutely.
Dr. Anu, Dr. Lala.
Oh, please. Thank you so much for having me. It's such an honor.
Same here. It's a privilege. And I think if everything is fine, we may just, we have about 4 minutes.
Yep.
Ajay was also be joining.
Actually, that ECT also, they are trying to make it the same way. Just few hours session, not the entire day. So there is a lot of discussion happening that how they are going to do. People know the entire day webinar are not successful. Everybody has to go back to work now and make some money.
Because
So we are designing the program, just learning from this. Yours that do every day few hours, that will have a better attendance. So maybe do 2 parts, one in the morning, one in the evening, for few hours rather than having a 8-10 hour session.
And our time actually suits everybody. 4 to 9 in India is like early morning in US, and little late night. Around 8, 9 in Singapore. So almost everybody can connect, and it was pretty good. But let's see how. But you showed the ways, with your webinars and your meeting, which has been going on for many years, and you were far ahead even before the COVID times.
COVID has taught us a lot of things.
Has actually.
So now only that after my presentation, I have 7 o'clock a different, my hospital related. We are doing a few of the, Zoom, my conference usually start at 6:30, but I postponed for 7. So that goes on for another 1-2 hours. So I would not be able to just continue that after maybe few minutes. If anybody has any question, person who is moderating, I can answer it, but then I'll just have to take my leave.
Okay, sir. You told me earlier. There's no problem.
Just want to confirm. Yeah.
So maybe we'll just start after a minute. It's 3:59.
Yeah. Sure.
Hey, Professor Khanna, how are you? Samin and Anu, nice to see you both.
And you have one more lecture after this, right? Ajay of 13 was there.
Yeah, I'm here. So you were speaking first, and I'm next.
I see. All right, my friend.
Yeah.
Good.
The camera was off. I was searching where you are. So I think the flow would be Dr. Sharma speaks first, and then Ajay, you speak, and then Dr. Anu Lala. Is that okay? And we have in the panel, we have Dr. Vinay Krishnan, who is the head of cardiovascular surgery and director of Institute of Cardiology at Kanpur. Incidentally, that's the second biggest institute of cardiology in the country, and they have about 250 beds dedicated cardiac institute, and everything is free there, right from an angioplasty to a valve replacement to LVADs, everything is free. And
that's fantastic.
We have Dr. Bansi Kaul, who is from Sweden. Again, he's a head of cardiac surgery, and actually he specializes in cardiac transplants in Sweden. And then we have Dr. G.S. Wonder, Dr. Harsh Vardhan, Dr. J.L. Sahani, and Dr. Ajit Jain, who is again a cardiac surgeon and now is the nodal officer for COVID in Delhi. Dr. Devabrata Rao is a cardiologist and the secretary, treasurer of the Cardiological Society of India. Dr. Rakesh Verma, who is the superintendent of Safdarjung Hospital and a cardiologist in Delhi, and Dr. Satyendra Tiwari, who is a professor of cardiology from Sanjay Gandhi Institute. So let's start, because cardiovascular, disease and manifestations in COVID, that is the prime thing. And today it's sort of a sad day when we had my immediate senior succumbed to this disease after 15 days of struggling with this. He was a chief of the task force looking after COVID patients in RML Hospital and LNJP Hospital. And then he passed away because he got COVID infection in that during his duty. And we could not save him in spite of giving all antiviral drugs, plasma exchanges, and convalescent plasma, and many things. So this topic becomes very pertinent, especially now talking about the case in question. He was fine till yesterday, and in spite of anticoagulation, I'm not sure of the dose, he had a massive PE and he succumbed to that. So with this background, let's start with Dr. Sharma, who's going to be speaking about reasons for reduced myocardial infarction during COVID-19 pandemics. This is a big missing link in STEMI. We do not know whether we have less STEMIs, or we do not know whether they are not coming and they prefer to have MIs at home and come later to us with LV dysfunction, or some of them are dead, already dead. But we really don't know, and this is a phenomenon world over. All of us are seeing less STEMIs in the hospital, but whether the incidence has come down or whether they are not coming, that is what is a big question. And Dr. Samim Sharma is going to be talking about it. So over to you, Dr. Samim Sharma.